This is the numeric version of what I just said. In other words, in aggregate, the total score, there was an adjusted odds ratio of 2.1, which means, as I said, they were twice as likely to rate their care in the highest category. This slide shows physician satisfaction, or actually change in physician satisfaction between the baseline, that is before the study started, and when we surveyed them anonymously a year later. The blue bars represent the change in the guided care physicians, or the ones that had worked with these nurses. And the orange bars represent the change scores for the physicians down the hall who did not work with the guided care nurses. You can see the blue bars all are in the upward direction, and a couple of them are statistically significant, meaning that the guided care physician satisfaction in all these dimensions shown at the bottom were all improved. The orange bars all went down except for one, meaning that the usual care physician satisfaction was actually lower a year later. One can speculate as to why that was. Perhaps envy at their colleagues down the hall who had this wonderful nurse working with them. The nurses were quite happy with their work. We surveyed them anonymously as well, and they gave high satisfaction ratings to all of these 7 characteristics of their position, saying things like, best job I ever had. I love getting involved with the patient and the family in depth and staying with them over time, and love the partnership with the physicians, and so on. Now, this is a very interesting slide. This is the utilization of several resources in the system. What I'm showing you here is not from the whole study. This is the subgroup of all the patients. It's about 40% of the total